Welcome to a special edition of Vetted, coming to you from the heart of DuBois, Wyoming, at the National Museum of Military Vehicles. Over Memorial Day weekend 2025, I had the honor of participating in two major events: the Veterans Talking to Veterans, or VTTV, Resource Fair, and the VTTV Coaches Graduation Ceremony, which brought together veterans, advocates, professionals, and families under one roof to celebrate both remembrance and renewal. The Veterans Talking to Veterans program represents a forward-thinking, multi-tiered model of peer support built around the training and certification of veterans as trauma-informed coaches. These coaches are not clinicians, but they are trained to understand trauma, to listen with intention, and to guide conversations that promote healing, resilience, and purpose. With VA approval of its methodology, the VTTV program is now gaining traction across the country and has been implemented in 12 new communities, including pilot initiatives within the Department of Corrections, a powerful testament to its adaptability and relevance. At the center of this expansion and ongoing innovation is my guest for today's conversation, Dr. Kent Corso, a clinical expert, systems thinker, and VTTV partner. Dr. Corso brings years of experience in behavioral health, military family systems, and veteran-centered program design. Dr. Corso, an Air Force veteran, also offers solution-based insights grounded in both research and field experience, discussing how empowering veterans to help each other creates sustainable community-level change. What he talks about is a reflection of what happens when veterans take the lead in healing and transformation. We honored the fallen that Memorial Day weekend. However, we also had the opportunity to look to the living with purpose, compassion, and determination. Join me now for this important conversation with Dr. Kent Corso, recorded live at the National Museum of Military Vehicles in DuBois, Wyoming. Let's get into it.
Hi, Ken. Thank you for joining me today. We are at the Veterans Talking to Veterans Resource Fair in Wyoming. And I think both of us have traveled far and wide to get here. Is that right?
We have. We both traveled from the East Coast.
And where are you from exactly?
So I'm located in Northern Virginia, right outside of DC.
Okay. And that is where, as most of my audience knows, that I am located in Maryland. I do a lot of my work in DC. Have you been there long?
Other than my time in the Air Force, my family and I have been there for the better part of the last 20 years.
Okay. And tell me about your time in the Air Force.
I went into the Air Force right after 9/11 in 2005. And when I got into the Air Force as a psychologist, we were very quickly informed that there were more deaths by suicide than by enemy fire. And so that really became the focus of my professional development. And ever since then, I've just really had a passion for suicide prevention, intervention, and post-detection.
And your title now is suicidologist.
Yes.
And you're one of three, is that I understand?
My understanding is there are about 100 worldwide.
100 worldwide.
And
Okay.
to be clear, a suicidologist isn't any different type of license or board certification. It means that I exclusively specialize in this area between research, practice, and treating patients. And then, of course, teaching and training.
Was there any special certification for this that you did? It's just the study exclusive.
It really is based on peer-reviewed publications and research. I am a licensed clinical psychologist, and I'm also a board-certified behavior analyst. I can say that most other suicidologists are either researchers by trade, so they are PhDs, or they're licensed clinical social workers, or licensed clinical psychologists or psychiatrists. There are a handful of nurses and educators. And then there are a few people who are more in the policy realm who would probably call themselves suicidologists.
Okay. We learned that today was the anniversary of mental health therapy.
That's right.
And not only is that fascinating that today would be the day that everybody would be certified as coaches and that we would be here together and talking, but it also so happens that happened the first in Virginia.
Virginia apparently was the first state about 50 years ago to make therapy an official license or to license people as therapists.
Now, For those of you who don't know, I grew up in Virginia. So, like Kent, who sort of was sitting next to me and did a little, yes, I feel that way as well. I would like you to explain to our audience what it is that you are here to explain to all of the veterans, the coaches, about what you do.
So let me start by saying that we have a strategic partnership with Mentor Agility, specifically veterans talking to veterans. Our program, CROSPER, stands for the Proactive Reduction of Suicide in Populations via Evidence-Based Research. And when I first met Dr. Julie Elledge, she and I talked quite a bit about our respective missions and values and visions between the two organizations. And since then, part of our curriculum is integrated into her 2-week curriculum. So when all coaches come through Veterans Talking to Veterans, they get a 2-hour module that is sort of exported from our curriculum. So part of this is solidarity and standing with your partners. I am an Air Force veteran, so it's important to me to still be a part of these community events. At the same time, Wyoming is a very special place when it comes to veterans. 12.5% of the population are veterans, and that doesn't even include their families. Also, Wyoming has the unfortunate distinction of having the highest suicide rates 4 out of the last 5 years compared to all other states. It is almost 2 times the national suicide rate, and among youths, 10 to 18, it's 3 times the national average. So we're grateful to be here to both support the veteran cause, but more specifically, to help discuss avenues and strategies to reduce veterans' suicide risk and to boost connectedness.
And your program that's incorporated into the training, what specifically do you focus on?
That's a good question. So if this were a 3-hour bit, I think I'd be able to unpack it all, so I'll try to keep it brief.
Okay.
Suicide's a behavior, and behavior is culturally influenced. So how we decrease suicide needs to be specific to the culture we're working within. So what works for decreasing suicide with veterans may be slightly different than what works in the civilian community, or for those who maybe are well outside of a military community, or military families for that matter. We're also in Wyoming, and this is the West, and there is a certain culture out here. They call it the cowboy culture, and that's not, I'm saying that as an outsider, that's not intending to be disrespectful.
No, not at all.
But Idaho, Utah, Montana, Wyoming, they've all got similarly high suicide rates. And so part of our program focuses on how do you take the values of the culture and leverage those to reduce suicide risk. A good example is there's a lot of talk in the suicide prevention community that encourages people to go get help, go seek help. Well, that's not what veterans and first responders and, frankly, cowboys do. They are, however, more likely to help themselves. And so in a location in a community like this, what we are trying to do is teaching them how to help themselves rather than believing that the more we encourage them to seek help, the more they will, because that's a non-starter.
Right.
One other cultural value that both veterans and Wyomingites share is helping your neighbor. Now, for veterans, it's really helping other vets. So if we can get people to help themselves and help each other, we're solving that barrier that people typically won't go seek help. Does that make sense?
It absolutely does. And I think that's something that I'm very focused on within my organization is bringing back helping your neighbor and the concept of service in this country. And it needs to start at a very young age. We need to be doing it nationally on a different level. So I'm very happy to hear that focus here. And I think that you're absolutely right about the culture here in the Midwest. And specifically these states. It's a wonderful example. And spending a few days here, it's so clear how everybody treats each other, how everybody, just walking into a store. I walked into a store and I'm not kidding, 10 people looked at the cashier and said, "Julie, you're here." And she just switched jobs from the grocery store to the dollar store. But it was adorable. Everybody knew her. Everybody was happy for her that she had this job. And so I definitely, those values are there, and I understand. But service is very important. Helping one another is very important. And I think that it's something that we need to address societally. And that is the concept that Veterans Talking to Veterans brings, is addressing this problem as one of helping each other service and treating it as a community problem, not necessarily in all cases as a mental health issue.
Exactly, exactly. And it's more than just a training program or a program for coaching. It's really a movement.
Correct.
And watching how Dr. Elledge has empowered people and then equipped them with the skills and tools to march out and serve in that way that makes them feel emboldened and makes them feel like they're doing something purposeful and meaningful, it's really inspiring. And that kind of a movement, you want to just give it a little bit of juice and then let people run with it, because their intrinsic motivation is what makes service so effective.
It is taking off. I mean, we were just talking about a couple states, and now I'm hearing Rhode Island. I'm hearing all over. And where do you see it going? How do you?
So I know that I might have a little bit of inside knowledge.
All right, well, I'll take
but-
that.
So I think location-wise, we know that we're expanding into Idaho. We know we're in Rhode Island, obviously Wyoming. Because some of the vets who we train come from the university and college setting, I do think there's sort of a cross-pollination that we're likely to see among other mountain states. So probably Montana, perhaps South Dakota.
So my daughter is at University of Rhode Island.
Oh,
She's studying psychology. She wants to go to medical school to become a psychiatrist.
excellent.
So I was very excited to hear Rhode Island. I'm very excited to hear what you just said there. I think that's fascinating. What in particular do you see as the most hopeful movement, in addition to this, with respect to mental health care in VA?
I think the Veterans Administration has, over the last 3 years, for the first time, seen a steady decrease in their suicides. So for 3 years in a row, 3 data points in a row, that's really, really encouraging. And so I do want to sort of tip my hat to everything they've been doing, from a headquarters leadership level to the VISN level, right down to the VA clinic or VA hospital within a community. They have done so much around standardizing the quality of what is practiced and delivered to our veterans. And they've done so much around making sure the training resources are there. What I'm excited about with I think, to your question, is mental health and suicide really are becoming less stigmatized. And we are seeing more and more people either seek help themselves or refer a friend or family member to go seek help. And these conversations 30, 40 years ago would not happen at a dinner table. So this youngest generation, the two younger generations actually, are much more willing to raise a flag and say, hey, this doesn't feel good. Something's wrong. Whereas the baby boomers and the Gen Xers, they were much more inclined to just be quiet and push on. And so it's really encouraging, because unless people start by raising a hand and saying, I need some help, nothing can move forward.
So one of the things I was really encouraged by the last time I heard Secretary Collins speak was that he was a big fan of Veterans Talking to Veterans, and also in particular of Commissioner Tim Shepard. And he liked Wyoming, he liked the programming that was going on here. And what I sort of derive from that is the community approach to this, and the understanding that while there may be waiting lists for therapy, the idea that coaching takes a lot less resources, and it takes a lot less time and education to get your coaching license, or your
Certifications.
Yes, and it's a completely different program. Can you explain that so that people understand what makes coaching different? What makes this program so
Sure.
unique, and why it's special, and why it could make such a difference in this community? Because I think that's a big bit.
What's different about coaching is, I think people sometimes have this mistaken notion that a coach knows everything and knows exactly how to tell you what to do to improve your game, right? I'll use air quotes. And that's not at all what professional coaching is. Professional coaching is this process of asking Socratic questioning, of supporting people and helping unleash and unearth their own strengths. So by helping them think through more clearly and from very different angles, think through what's going on, they end up finding their own answers. And that's what's so transformative about coaching. There's a growth process that happens. Now, there's also a growth process with psychotherapy, but it's very different. As you mentioned earlier, it may take 2 to 7 years for a therapist to complete all of the educational requirements and then get licensed. And let's be honest, they're not competing strategies. They're two completely different modalities. The reason why coaching is so special is it's more accessible. If we can get people trained up more quickly, then that means we can grow that part of the workforce faster. That's right. What's so special about calling it a workforce is they're all volunteer in Veterans Talking to Veterans. And that's what makes this so powerful, is that it's not based on a business model, it's not based on a market analysis or a business case analysis. It's based on finding people who care enough to keep caring for other veterans. And so it's such a grassroots organization. You mentioned a moment ago about the community. There is so much power that comes out of looking for the solutions in the community. And whether we're talking about veteran mental health or whether we're talking about suicide more broadly, the community plays an equally as large role as all of our formal healthcare and mental health systems.
Do you have to be a veteran to be a coach in this?
You do.
Okay.
You do. And so there's this funny thing with, it's sort of like nurses take advice from nurses, doctors take advice from doctors. Veterans tend to trust other veterans. And so part of what makes it so powerful is the source of the coaching is another veteran.
And describe what happens for the viewers in these. It's not a one-on-one coaching situation.
There are both. So there's group coaching and one-on-one coaching. Now let's be clear, that doesn't mean it's sort of like group therapy or individual therapy. It is definitely a process that unfolds where in real time people are engaging with their thoughts and feelings. But at the same time, what's unfolding is some insight and some clarity, but without it coming from the facilitator, without it coming from some therapist. And what we're really doing is helping people access the strengths that they already have inside, whether it's a prior experience where they already know how to do this, but this situation seems to deceive them a little bit, it looks a little different. Through the process of storytelling, we learn so much about ourselves. And so by telling stories and hearing stories, all sorts of light bulbs go on that help people make different connections for their own lives that they hadn't made before.
Okay, so my next question for you would be, what is storytelling? I'm a little unclear about what the concept of storytelling is.
So the idea of storytelling is to share of yourself, but in a way that is not to try to impress anyone. It's not to try to have a specific impact on them. It's really just to reveal something about you that they may not know.
Okay, so give me an example. If we are to come in, if I'm to come into a coaching session or any session, does the coach share a story and then we all share?
The coach may share a story.
Okay.
The coach may do a go around and sort of a check-in. How's everybody doing? Is there anything anyone would like to share?
Okay.
So it's not highly directive.
Okay.
Time is managed very well,
Okay.
but it's not highly directive where you're sort of forced to do certain things or expected to do certain things. Everybody is at a different place in their comfort and their willingness to share. And so we need to meet people where we are, not try to force them along to where we want them to be. And that's what makes it empowering, is that we set aside the space and the time and then really allow people to engage as they can.
Okay. So my understanding in talking to other coaches is that a lot of these are virtual, and that you can sign in basically from anywhere across the country. You can join a different cohort, and that's also really something that's exciting, I think, because it doesn't matter where you are. You can join in and be part of a particular group if you've heard from a friend or a loved one that hey, this is really powerful. I really enjoy this. You should join mine. I think that's really something that's pretty amazing.
It's highly accessible. And it also allows for anyone to enter different coaching circles or coaching groups. And if there's a certain chemistry that they really enjoy, there's a factor where they click or they just something resonates, then they can choose that. And that's what's, again, it's empowering. We have to allow people to find their own way and provide the guardrails and structure for them to get there, but not force them there.
Well, what else would you like to say? What is
The only thing that's on my mind, Jen, is that it's really hard to get veterans to seek help themselves. But what is so clever about how Veterans Talking to Veterans is structured is that if you tell veterans, we have an opportunity for you to help other veterans,
Yes.
they are all in. And now, in order to help other veterans, you have to do a little work to get there. And that's going to involve doing a little work on yourself. So it's this fascinating way of giving veterans an outlet for that intrinsic motivation where they really want to serve and really want to help each other. But at the same time, they're also gaining some healing and some growth. Maybe it's post-traumatic growth that they might not have sought help for on their own.
Well, I asked you what the most hopeful part of VA was. What do you see as the biggest challenge that you're seeing from big VAs, state VAs? What do you see as the challenge that as a mental health provider, caregiver in the community? What do you see as that biggest barrier that you're facing?
So I think the biggest barrier that veterans face is some of it is frankly PR. So there are periods where many government agencies or even private businesses, they have good years, they have bad years, years where they are very struggling very much, and then years where they are on the top of their game. So I think there's the ebb and the flow that happens at the desk, in the clinic, at the door of all these centers are really incredible human beings trying to serve our veterans. But there's policy, there's adminutia, there are politics, there's bureaucracy. So I see the biggest challenge not in the humans, I see the biggest challenge in just how the system gets so complex and difficult to work with. And again, that's not attributed to any one person. It's kind of the nature of the beast. The VA is the largest healthcare system in America. And as the largest healthcare system in America, you're going to have big challenges.
I could not agree with you more. And I see that, I come on here and I think a part of what I see as my goal with the podcast, with my nonprofit, is to serve as, a bridge between the two. I know both sides very well, and I have so many good things to say about VA. I think that it is so misunderstood by so many veterans after so many years of just bad PR, and a lot of gossip, a lot of misunderstanding, misperception, whether it's because one neighbor, one friend had such a horrible experience, and it's like the game of telephone, right?
Yes.
And well, I'm not going to go because my buddy this and that, and that's just unfair. So, but we need to change that. We need to change that. And I think they've done an excellent job. There's so many resources, so many wonderful programs and things that veterans are entitled to that they're not using because they just don't know about it, or they don't appreciate how much change has happened over the last 10, 15 years. And that has to change. But the benefit system is what sort of brings it all down, because that's where the bureaucracy lies. Yeah. That's where the errors lie. And until something changes there, we're going to have the same public relations nightmare, because, it's the canary in the coal mine?
The canary in the coal mine, that's right.
That's it.
I love what you're saying there. I think there, like any system that isn't perfect, there are mistakes that have been made. Yeah. For every one nightmare story where there was a very big mistake made, there are 1,000 success stories, but that's not what we hear about. We tend to hear about the most extreme, egregious, objectionable problem that happened. And again, those have happened, but by no means is that the norm or what is sort of your average experience.
We heard today, somebody stood up and said, the VA saved my life.
That's right.
And I love that.
I do.
I love that.
I do too.
I really believe that, if you're going to complain about stuff, Hey, and I will complain, but I will also be the first one to call the 1-800 number at the bottom of a receipt and say, hey, I had the best experience today at Giant with, your store clerk who went and found me the creamer I've been looking for. I have no problem doing it because, I think that's the way it should be
It's
done.
important.
It
It's
is
important.
important.
I loved what Dr. Elledge said in response to that veteran standing up and saying, the VA saved my life. What she said was, you can only, I'm paraphrasing here, you can only control your own actions, you can only control yourself. And so, whatever change you want to see in the system, make it happen. And it's that old phrase by Gandhi, be the change you want to see in the world.
Yes.
Right? Don't sit back and fold your arms across your chest and say, this needs to be different. Get up and facilitate that change.
That's the way I try to live my life, to my children's chagrin. That's the way I try to teach them, and I know that's the way you're living your life. I see it, and I appreciate it. And thank you so much for joining me and sharing this with everybody else.
It's been a lot of fun. Thank you so much for having me. It's been my pleasure, and I'm very humbled to be a part of this wonderful event today.
Well, I look forward to working with you and talking with you again. I hope you'll come back. Well, actually, we can do this in Virginia.
That'll be a lot closer.
Yeah,
Easy.
sure will. But it's nice here. All right. Thank
Thanks.
you.
Yes.
Thanks very much.